I realize what happened in the House with that discharge petition involves a unique tool in the House. Will John Thune be compelled to bring a similar extension back to the floor after what we just saw today?
Well, I hope so, because what you're talking about has happened in the House is based on the need of the American public. I think both Democrats and Republicans realize the American public is demanding that they still have affordable health care in this country that includes those subsidies for enhanced premium tax credits. That's why you're having that vote there. And as you recall, when we had the vote in the Senate, we had 4 Republicans that joined us on that 3-year extension. Yeah. So it really is the American public speaking up, saying we want this, and it's a bipartisan solution to addressing some of the high health care costs that we have in this country right now.
Well, it must be a frustrating moment for you after going through the longest government shutdown in American history over this very matter, knowing that we are going to go over the Obamacare cliff no matter what happens in either chamber here. You'll be back in January, and I wonder, Senator, what happens then? If this is convincing to moderate Republicans, does that spawn a Gang of 8 or some sort of compromise committee, if you will, that will bring about a new piece of legislation in your chamber?
Well, let me just say this. There's talks happening right now on the Senate side, and they need to continue. But we have to address what's going to happen next year. That means a clean extension of some sort has to take place, even as we talk reforms. I think there's bipartisan talk to figure out how we reform some of this and still make health care affordable for so many that have the Affordable Care Act. But we need the extension first. Otherwise, what's going to happen is what you just said. Millions of Americans are going to go fall over that health care cliff, either not be able to afford health care, or paying higher premiums that are just outrageous at this moment when they're already seeing high costs from grocery costs, housing costs, healthcare costs. They're already being strapped with the high costs of this economy. So we need to do something. And those talks are happening right now. But I am hopeful, and I'm going to count on my Republican colleagues in the Senate to come to the table and do the right thing here for the American public.
Well, I actually am one who believes that no one really wants a government shutdown, but sometimes you can sleepwalk or slouch into one, Senator. And with the discord that we're seeing in both chambers and the incredibly tight margins, if this doesn't get done in time for the funding deadline at the end of January, if there's no deal on health care, are we shutting down again?
Well, I can tell you part of the extension we gave to end of January so we can get the bills done, the appropriations bills. We've already passed, 3 or 4 of them. Tonight, and you and I were talking about this, we might have similar votes on another 4 provisions of the budget that we need in a bipartisan way in the Senate to move the appropriations bills. I think we need to do that. We need to do our jobs, work in a bipartisan way, appropriate the dollars that are necessary to keep the federal government open. We're working on that. And if we continue down this path, we don't have to worry about the end of January and that deadline, because we'll have already appropriated the bills.
Mm-hmm. You know, there's been a lot of questioning of motives on both sides of the aisle, and that's where we are with not a heck of a lot of trust right now after the last year that we've had on Capitol Hill. Congressman French Hill, Republican in the House, who chairs the Financial Services Committee, was talking about a little bit earlier today what Republicans are trying to accomplish, Senator. I'd love for you to listen to what he said.
What Republicans are trying to do are side with American families across the board and lower premiums across the board, and we've consistently brought bills to the House floor to do that, and we've had Democrats reject them. Last week, the Senate could not find a consensus on this, and that's the definitive place. That was the commitment made during the spending votes.
Do you believe that Republicans are actively working to lower health care premiums?
Well, I can tell you this. The simple thing to do right now, if they really want to address this issue, is just do a clean extension. They want to talk reforms. We're willing to talk reforms. Capping the income at the high level. We're talking about what we can do to address the waste, fraud, and abuse they have concerns with. We have concerns with it. There are reforms that we can discuss and actually move forward on. But we have to do an extension, because what we're going to see right now in the American public come January, or actually the end of this month, too many people are not going to be able to afford their health care. And let me just talk about this. These are individuals, these are families that require that health care because their child has a rare disease. This child may not get access to health care. These are individuals or small businesses that rely on the Affordable Care Act and these subsidies for health care. Now they're going to have to decide, do they even keep their business open? Can they afford health care? I mean, this isn't a decision that American public and small businesses should have to make. We should make it easier for them to afford health care in this country, to access it when they need it, and it should be quality health care. And that should be bipartisan work, nobody playing politics with it. So count me in the camp of, let's do it a clean extension. You want to talk reforms? Then we get in a room and do it. But let's just make sure we're taking care of those people the next 2 years so nobody's falling off that health care cliff. And finally, let me just say, Republicans are in control. They very easily could have done this. The House could have done this. Even, you know, let me just say, Speaker Johnson shut down the House for over a month. And they weren't even here. Had they been here, they could have been working with the Democrats to figure out a path to address this very issue. So we're not running up against this deadline right now.
Well, Senator, the Republican-led Senate did get something done today in passing the annual defense authorization, NDAA, the must-pass bill, as we like to refer. Pretty convincingly as well. Who says he can't get anything done? 77-20. Do you expect the president to sign this into law this week?
I do. Listen, this is a great example of where when we work together in a bipartisan way, we can get something done, pass it out of the Senate, pass it out of the House. It's a benefit to this country, and have the president sign it. And so we just did that today. You've just talked a little about it. And most people don't know what NDAA is. It's a Defense Authorization Act. This is how we fund our military. This is how we support and protect our national security. There's so much involved in the NDAA, and it's crucial that we pass it and we work in a bipartisan way to get it done.
You know, it's something that includes prohibiting U.S. investment in certain technologies in China. Is that going to collide with the administration's plans in a remaining moment, Senator, when it comes to high-tech AI chips being sold to Beijing?
No, not at all. So you're talking about an amendment that John Cornyn and I had put into the NDAA to prevent American investors from investing in technologies in countries like China or our adversaries like Iran and Russia. We want to keep those dollars here. We want to invest in AI here and making sure that quantum computing and quantum mechanics, that investment is here, right? Hypersonics, we're investing on all of this new technology in the United States. It passed in the NDAA. It gives Treasury the opportunity to create that framework, that outbound prohibition framework, as well as the notification framework, so we can ensure that we're protecting that investment and our national security here.